And the other thing I'll mention is an important part was that feedback loop and making sure you're not going to get buy-in with your team if you're not sure that the product is kind of responding to you and you're able to give critical feedback. From the beginning, we were told give negative feedback. If you're getting some like periodically for our clinicians and our support staff, it'll pop up like how are we doing? And they're like give negative ratings. If it's not doing what you want, put it in there, put comments because we will improve this tool. And we saw that to be true. We saw this happen over time, and we saw beforehand we were able to see like what are common issues coming up right now, and we were able to see what those common issues were, and we could see how it was being addressed and how like notes were getting better and better because of it. And we actually had a situation where in our journey we started adopting it. Which is great because during our training, you were able to write a note and people left the training being able to kind of see what this looks like. We started getting feedback. We think there's some hallucinating happening. And so like they gave an example, they said gave some details of the note and then showed what the note looked like. And so we worked really closely with Elios as part of that relationship, with clinician to engineer kind of relationship to be like, what's happening here? We cannot have, this happening. And it turns out with this back and forth that it was the audio equipment that we had, that the laptop we were using had some faulty system. And so by changing the technology, we were able to fix it and eliminate the concern that hallucination was happening, which was critical if you're going to get team buy-in. And so like both we were looking from a clinical perspective, like, is this a good tool? Is it a secure tool? Is it a clinical tool? But also, will it work with us and be there with us to make sure that we're going to get the buy-in and support and comfort in knowing it will improve as needed. It will also be able to work through any issues so that you don't lose, like the minute it gets out there that, it can hallucinate. It's not always accurate. It doesn't work all the time. People are going to stop using it. And so we wanted to make sure when we invested in a tool, not only did we feel confident, but if we came across any issue, we'd have a partner in the process to make sure we got to the bottom of it. So we would have a really strong tool that just improved over time. And that's what we've seen.